Thursdays, we set aside Claire Corbett, and just looking at me like I'm nuts right now. Claire Corbett joining us right now. May Stroke Awareness Month, and she just told me something off camera that I had no idea, that there was a term called the stroke belt. And the state of North Carolina is in it. I had no idea.
That's right. It's the stroke belt is a region of the country that has the highest incidence of stroke and the highest death rate of stroke, and North Carolina is part of that region.
And why is that?
They don't really know. They don't really know. The stroke belt is similar to the diabetes belt. It's the same region, but people don't really know. What we do know is we have a lot of stroke in the region, and it's important that people know about it.
We were talking beforehand about ways that you can prevent things like this, and you were saying right off the bat, it's just knowing the risk factors.
That's right. So for stroke, there's risk factors you can control and those you can't control. The ones you can't control: age, the older you are, the more likely; gender, women have more strokes; race, African Americans much more likely to die from stroke; if you've had a previous stroke, you're more likely. But then there's risk factors you can control, such as high blood pressure, the most important one, smoking, high cholesterol, eating a diet high in fats, sodium, cholesterol, inactivity, obesity. All of those are risk factors that you can control.
If we had an episode at the house, and I'll bore you with the details, but if you think that someone is having a stroke, what are the first things that you should be looking for?
Okay, so if you think somebody's having a stroke, first of all, call 911 immediately. The sooner you get help, the more likely you are to recover from stroke. But some of the things we look at are slurred speech, facial droop. If somebody has weakness on one side or the other, we teach everybody FAST, F for face, facial droop, A for arm drift, weak arm drift, S for speech, and then T for time. Okay,
and I've heard before also that there's a 3-hour window. Is that a myth, or is that kind of the ballpark that you have?
It's true. We have one medication that is FDA approved to treat acute stroke with. We only have a time window up to 3 to 4.5 hours from symptom onset to treat. After that, we can't use that drug.
Men or women more susceptible, one way or the other?
Nope. Well, actually, that's not true. Women do have more strokes. The symptoms are going to be the same. I think women are much less likely to call for help because they don't want to bother people.
Really?
Yeah. So.
Well, I mean, that's a perfect way to, it's always my tagline. If you have questions, don't call me. As you say, call 911.
Yep.
Don't wait. Don't mess around with something like this. And if you have any other concerns or things like that, you always want to consult a physician. Don't email me. Don't call me. I don't have answers like that. You always want to go to a professional.
That's right. And have a primary care doctor to help you manage your risk factors.
Yeah. Claire, I appreciate your time.
Yep,
Thank you this morning.
Thank
now
you.
we throw it over to